I'm Chris Gedney, and I live in North Central Phoenix, right here in sunny Arizona. I can take you all the way back to as a kid playing every sport there was, to high school, four-sport athlete, college, played basketball and softball, and then in the Air Force. I spent 22 years in the Air Force. But all the way back to college, I had a little bit of crunching under the kneecap. Fast forward, was having some knee pain. Last summer, we went to 6 national parks and my left knee blew up like a balloon. It would not go back down. It was, basically bone on bone. So that's when I started, looking for the surgeon who was going to be able to do that, take care of that for me. And I was just really hoping that what I had heard about knee replacement was true, that you could get back to a relatively pain-free life and get back to enjoying a lot of the things that I used to like to do. So I called up a friend of mine who worked in the ortho clinic at the VA, and I said, hey, this is what I've been told, I'm gonna need surgery. And she basically said, you want to be referred to community care, and we have the perfect surgeon for you. And his name is Dr. Joshua Silver. Long story short, I also happened to have a friend of a friend who he did both of her surgeries 6 weeks apart. She was doing great, and then I finally made the decision to call him, and he's just the most approachable guy. He walks in the room, plops down on a chair, says, hey, I'm Josh, how are you? And I was like, that was just, and no hard sell. He's like, here's what I see, here's what I think's going on. I could do the surgery, I could not do the surgery, it's totally up to you. What do you think? It was a perfect fit right off the bat, and he's the only surgeon I talked to, and I was really happy that I found him. So after talking to Dr. Silver and he talking about the surgery part, he was very clear to say that 90% of the recovery is up to the patient. So, he's going to do a great surgery, but really 90% of your recovery and your ultimate range of motion is going to be how much you put in at physical therapy. I feel like he's very straightforward as far as, hey, it's completely up to you, but here's what you're looking at. If you don't do it, it's just going to be that much harder down the road. We're going to have to take out that much more bone. Arthritis is not going to stop. I will say that the first surgery, just waiting to see how good I was going to feel, week by week and month by month. And then of course having the second surgery, 8 or 9 weeks after the first surgery, I knew exactly what I was getting into. But I will say that 10 weeks after my second knee replacement, I was already playing in a pickleball tournament in Palm Springs. Played 6 or 7 pickleball games in our 3.0 bracket, and my partner and I won the gold 10 weeks post-op. Everybody around here, anybody in the local Metro Phoenix area, I would highly recommend him. And I would just like to thank Abrazo Orthopedic Specialists and Abrazo Scottsdale campus for their participation in this entire process, and couldn't have been happier with all of that. I do understand that, these replacements take, 6 months to a year to be fully healed, so I'm not going to do anything crazy and push it too far too fast. But I mean, I was at the gym yesterday working the Smith machine with the leg presses, and getting about halfway back to the weight I was doing before. And so I feel really good about everything that I'm doing: golfing, cycling, walking, hiking, pickleball. I'm doing everything that I want to be able to do at this point in my life.